Maternal care in many developing countries is a problem. This is a typical example of why women are dying in many low-income countries. This is Nigeria. This is a woman in labor in the federal capital city of Nigeria, Abuja. Watch this video with me.
Mama, good morning, ma. Yes, ma. How you doing? You look like you are really tired. Which side are you going to? You want to cross? Can you take a cab? I'll pay for it. Don't worry. Please, let me get you a cab, please. You look so tired. You look like you're about to. Please.
Hello. That money. Hello.
Yes.
Madam.
Okay. How much did they ask you to go and look for? They said she got to bring 28,000 for them to admit you, right?
There are a lot of things wrong with this video. One, I'm going to break it down into 3 or 4 things that needs to be done to improve healthcare for women in Nigeria and in many developing countries. Now, looking at this video, the first thing I observe is this woman looks physically distressed. She looks unwell. And this is a woman in labor. And I can't help but imagine, I can remember my labor experiences, being asked to go from one hospital to another when you were having contractions. This woman had to choose between getting the money for transportation and using the money for a hospital bill. And this is a reality of many women in developing countries. They make these choices all the time. They choose between whether to use money for feeding their children or to use money for their medical needs. So here you hear the woman say, give me that money that you will spend on transportation and I will use it for my hospital bill. And this is one of the issues with maternal care in Nigeria. There's lack of transport for women. Many women cannot afford transportation. A lot of women have to walk miles to get the support that they need. And a lot of them are already having contraction in labor and they have to walk miles to get to the hospitals. When there are no cars, they can afford transportation. So one thing that can be done to address this issue is 1, family structure. The family structure and support system is very important in supporting pregnant women. Where is the family circle around this woman? Where is her husband? Where are her children or family members or friends? Where is the community support that this woman has? Okay. I believe in Nigeria today, or in many communities, women should start building communities for pregnant women, to come together to share their experiences and to share knowledge. Community support is very, very important, especially during the late terms of their pregnancy. I can see this woman isolated. I just want to appreciate that lady that supported her through this period. I could see that this woman was physically distressed. 2, socioeconomic factors. This woman was asked to provide 28,000 naira. This is 15 pounds roughly, before she can be seen to. And this is a woman in physical labor having contractions. 15 pounds. She's unable to afford it. So poverty is a big problem in many developing countries. And how can this be resolved? There are not 2 ways about this. Government should support women in this situation. We need emergency obstetric care that every woman that is pregnant that needs support is able to access care at the point of need, okay, without questions. So government should do the needful to support women to gain access to necessary care when they need it, because this is a life and death situation. Now, this woman, went to a hospital and was asked to go back to her previous hospital to get her medical records and to bring 28,000 naira, 15 pounds. And by the time she was walking down, she had no money for transport. Walking down, I know how hot it is in Nigeria. And she was supported by someone on the street. And on reaching the medical facility, told her there are no bed spaces. So she was referred to another hospital. And referred to another hospital before she got there. Then she lost the babies. I don't know how she's doing now, but the story is that she lost the 2 babies. This is unfortunate. This is a preventable death. This is unnecessary death that should have been tackled better. 3, there is no empathy in care. Okay, I can understand how a pregnant woman will be sent out of a hospital when she's having contraction. Where's the place of virtue, ethics, care, sympathy? I understand that there are a lot of elements to this, and there are a lot of systemic issues today, because the medical hospitals and facility also need funding to take care of these patients. So I'm not putting the blame solely on them, but there's a place of empathy. This woman would have lost her life walking on the street of Abuja. Something needs to be done. There needs to be facilities where women can access care promptly, urgently. Emergency obstetric care is paramount, is needed in our developing countries, especially in countries like Nigeria. So 1, family support, income, and the responsibility of the care providers or healthcare providers is very, very needed. This death would have easily been prevented if this support were available to this woman. And there goes the story. Very, very sad story. And this is why I'm advocating for proper care in developing countries. This is our Mother's Health Podcast. I'm Dr. Viviane Chinwah, and I bring you live weekly updates on maternal care issues around the world, the hidden stories behind the maternal death statistics. And this is a typical example of how women are losing their lives in low-income countries. Do join me every week. And if you want to share your story on this podcast, it's OMH podcast 2020-25 @gmail.com. Connect with me, send me an email, and send me a DM on my social media platform. Thank you for watching.